Hello, everybody. Welcome to the Worcester Senior Center Distinguished Speaker Series. My name is Suki Lapin. I'm the Worcester Senior Center Program Coordinator. We have a wonderful program planned for you today. We could not put on such a program without our wonderful sponsors. Today, everyone will get a t-shirt from Fallon Health, who sponsored lunch today. Thank you so much, Fallon Health. If you did not receive your t-shirt, you will get it after the program. We don't want this disturbed. That is being filmed by Cable Services, who we also want to thank today for all their hard work, putting on wonderful programming for us. Our other incredible sponsor is the Worcester JCC. Thank you so much, Nancy Greenberg. Without you, Dr. Rosanne would not be here today. Thank you, Vibra Hospital and Loyal Home Care Services for providing coffee, and so nice of you. The WISE program, Worcester Institute for Senior Education, and the Jewish Healthcare Center. During lunch, we have wonderful entertainment by the talented pianist Jim Perry. Now I am thrilled to introduce my dear friend and colleague, Nancy Greenberg. I'm all choked up. Don't cry. Worcester JCC Cultural Arts Senior Adult Director, who will introduce today's distinguished speaker. Welcome, Nancy.
Thank you so much, Suki. It is truly my pleasure to be here today. I'm Nancy Greenberg from the Worcester JCC. I'm the Cultural Arts Director. The JCC and the Worcester Senior Center have a long history of collaboration now, and it is my pleasure and honor to be here this morning as we co-present Dr. Rosanne Leipzig, discussing her new book, Honest Aging, An Insider's Guide to the Second Half of Life. I'd also like to thank my colleague Suki Lapin, who has made every single event we have ever collaborated on successful, fun, and beautiful. Decorations always that go with the season. I would like to just take a moment to thank our sponsors again for making today's program possible. A few housekeeping notes. We will leave time for audience questions following Dr. Leipzig's talk. And following the Q&A, Dr. Leipzig will be signing copies of her book, Honest Aging, in the back of the room. Some of you have already picked up a copy, so thank you. We're selling them for $20, and be sure to get your copy here. That is below the Amazon price, and a signed book makes a great gift. The holidays are coming soon enough, and please note that, again, we are selling them below the Amazon price for $20. So, Dr. Rosanne Leipzig is the Gerald and May Ellen Ritter Professor and Vice Chair Emeritus for the Brookdale Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai. Internationally recognized in the field of geriatrics, Dr. Leipzig is a trailblazer in transforming the way we approach aging individually and as a society. In her 40-plus year career, she has treated thousands of patients and trained hundreds of doctors and practitioners in all specialties of medicine. She has been repeatedly named as one of the best doctors in America, America's top physicians, and a New York Times super doc. From last Sunday's Washington Post article, her book climbed to number 6 in the self-help and 42 overall on the Amazon list. So that's rather remarkable. So enough from me. Please welcome Dr. Rosanne Leipzig.
Thank you. Can you hear me? If you can't hear me, do this, because I tend to have a soft voice. Speak up a little. Is that better? Yeah. All right. So it's really great to be here. It's always nice to be called a distinguished speaker. I think that started when my hair turned, okay? Kind of a gray and then white. It's been a long time, though, so I don't think I've been distinguished that whole time. It's wonderful to be here and to see all of you. So I'm going to start I'm going to be asking you some questions at times, and when I do that, I'm just going to ask you to raise your hand, okay? And this is the first question because this helps me know who I'm talking to, okay? So raise your hand if you are under 30. Just checking. Okay, I see you. Okay. How about if you're 30 to 49? Okay. 50 to 64. We're getting some. All right, good. 65 to 74. Many more. 75 to 84. Good group. All right. And how about over 85? We've got a good number too. Fantastic. So my next question is, are you lying about your age? And if you are you saying you're older or are you saying you're younger? Because at different times in our lives, we've done both, right? Okay. I'm going to start by talking about our society and our perceptions of aging, because I think our perceptions of aging really influence how we age. So I have a wonderful friend who is a clinical psychologist, and he turned me on to the idea of looking at birthday cards to get a sense as to how we think about people at different ages of life. And he showed me this one. It's your birthday? So how do you feel? I feel like a newborn baby. Really? Yep, no hair, no teeth, and I think I just wet myself. Happy birthday. Nice message, isn't it? Yeah. And if you look at these, it's like one after the next, all right? Even Grace from Grace and Frankie feels the stigma. Which may be the worst thing, right? Okay. What we're talking about here is ageism. I think you all have heard the term over and over again. It's like sexism, it's like racism, it's prejudice, it's stereotyping, it's being bigoted. It's saying that this group of people are all one way. And what I'm going to tell you today is that that's not at all the case. And you know that already. I don't have to be here to tell you that. But when we talk about ageism, there's ageism that's in our world, okay? And that's the birthday cards. There are a lot of things like that I'm sure you can all talk about. And then there's our own internalized ageism. Many of us don't think kindly about getting older, okay? And that happens to young people. They start getting this thing about, I don't want to grow old, okay? And we live in this young culture. The problem is that that follows us into our old age. And it's bad for you because you're prejudiced against your future self, all right? And what I think about here is that it's really a self-fulfilling prophecy. And there is another clinical psychologist over at Yale, Becca Levy, who has looked at this a lot, and she's done some amazing work during her life that has shown, number one, if you have a positive attitude toward aging, you'll live about 7.5 years longer. And you'll live better. You won't just be existing those 7.5 years, okay? She took older people, people 65 and older, put them before computers, had them do some task on the computer. Half of them got pictures that were negative images of aging, and the other half got pictures that were positive images of aging. And then she had them do memory tests and hearing tests. Now, I'm a doctor. To me, those are objective tests. However you do, you will do every time you take the test. Turns out not to be the case. Those people with negative viewpoint, who got the negative pictures, of aging did worse on the hearing tests and on the memory tests, okay? So we have some control over what our old age is going to be like. Not over everything, but about certain things. And we need to take that. This is my grandmother, my Bubby, okay? Bubby lived to 86. She had 21 grandchildren. The one she's sitting with is my cousin Bonnie. She's the youngest, all right? You look at a picture like this, and you have no question who's young, who's old. But my grandmother was incredibly vibrant. She had medical problems. She had colon cancer. She had a colostomy when they didn't work so well. She lived with us for 7 years. When she turned 75, she said, enough, I want to be back with my people. And she moved back to where her friends lived, okay? It wasn't that she didn't want to be with us, but she had a whole life that she had kind of given up a little bit. And if I had asked my grandmother what it was like to get older, she would have said to me, whoops, sorry about that. Well, what she would have said to me is, you're only as old as you feel, and you let yourself be, okay? So the question I want to start with you is, what is old age? And this is Bernard Baruch, the great statesman, and he said, to me, old age is always 15 years older than I am, okay? I have to tell you, in my life, this is very true. When I was about 35 or so, I was doing a fellowship, and my major professor had a 50th birthday party. And I was, oh my God, how could he possibly be that old? Now, when I get invited to a 50th birthday party, how can they be that young? Okay? It's all relative, right? So in our perceptions are a bunch of ideas about how we feel about growing old. And what I found is that there are some people who want to be wise old owls. They want to know what to expect and figure out what to do about it. There's another group of people who are worrywarts. They learn stuff and then they worry it's all going to happen to them, okay? Some of it will, all of it won't. And then there's that large group of people who have their head in the sand. They're never going to grow old. They're going to go to sleep and die, and that's the end, okay? Doesn't work that way for most people. So what is it that we fear about getting older? There's several things. The first thing that people tend to mention is death. And yes, death is closer as you get older. But it's interesting, the studies have shown that most older people are less concerned about dying than about their function, whereas younger people are very scared of dying. It's that physical and mental deterioration that we hear and we see that people are concerned about. We're also afraid of being alone. And men have the edge here, okay? They're much more likely to remarry and not be living alone. We're afraid we're going to be burdens, whatever that means to us. We feel like we're not as relevant as we used to be. Part of that can be when you're standing in a line and the clerk bypasses you for the younger, cuter person who's standing next to you. Part of that is when you mention something and people look at you like, so when I'm speaking to the medical students and I mention Marcus Welby, they have no idea what I'm talking about, okay? Clueless. And the biggest thing is the uncertainty. You just don't know what's going to happen. And that's a part of your life the whole way through, but it happens more as you get older. So what's reality? What should you expect as you get older? That was the question that I was asking when I wrote this book. Kind of the what to expect when you're expecting, which is, of course, for pregnancy, for aging. So where I want to start is to make sure we're all on the same page and do some reality checks. How long are you likely to live? Now, this is, a big statistical thing. It doesn't mean you personally, but in general. And what shape are you going to be in your old age? We're going to start with something called median life expectancy. What does this mean? At every age, when you're born, when you're 20, when you're 21, when you're 65, there is a median life expectancy. That's the age to which people who have attained that age, half of them will live beyond and half of them will die before, okay? So in this country at the moment, at birth, median life expectancy is somewhere around 78. Certainly not the highest in the world. I want you to tell me, for people who are 65, at what age will half of them continue to live and half of them already be dead? Just shout it out. 75. 80. 82. 82. Pretty good. 84. Okay? Good. Now, I have to tell you, I ask this question when I am rounding with the residents and medical students. Every year, at least one person tells me it's 70. And I tell them they got to get out of the hospital, okay? They're seeing the sickest of the sick. They don't know what well people who are older look like. They should come here, okay? How about if you make it to 85? What's median life expectancy for people who are 85? 90. Right on, 92, okay? And men, this is where your life expectancy starts being the same as women. Up until then, women were living longer. And what if you make it to 100? 121. 102.3. The longer you live, the longer you're going to live, okay? So you're going to live. And what will your life be like? Because that's really what most people are concerned about. So I'm going to, again, ask you a bunch of questions. This is where I'm going to ask you to raise your hands, okay? So the first question is the percent of people who are over 85 who say that their health is good or excellent. And I have to tell you, this is really a good question. We use it on surveys of older adults, because if somebody says their health is good or excellent, it probably is. And if they say their health is fair or poor, it probably is. So I'm going to give you a choice going from 10 to 90%. And just raise your hand. Who thinks that 10% of people over 85 say their health is good or excellent? Okay. A couple. Who say 30%? A few more. 50%. A lot more, okay. 70%? Some. 90%. Okay, we got a few. I'll tell you the answers in a few minutes. Second question. The percent of people over 85 who have significant limitations in their vision, their hearing, their mobility, their ability to get around, communication, cognition, or self-care. And this is a 10 to 51, okay? So who would say 10%? Okay, small number. Who would say 20%? Small number. 30%? More. 40%? A lot more. 50%? Okay, 40 and 50% are the winners for this one. The percent of people over 85 who are living with dementia. Again, this is a 10 to 50, all right? 10%? 20%? Okay. 30%? A lot more. 40%? Okay. 50%? So we're kind of between 30 and 40% here. And lastly, the percent of people over 85 who are frail. Now, I'm going to explain to you my definition of frailty later. I want your definition right now, okay? So this is between 10 and 40%. 10% of people who are over 85 are frail. Okay, we got a couple. 20%. Got more. 30%. Many more. 40%. Lots more. 50%. Okay, so that's around 40%, okay? So let me give you the answers for those. The first is the percent of people who report good or excellent health. 70%. Okay? The percent who are living with dementia, 28%. And what you should know is that percentage has gone down. And the reason it's gone down is that heart health is brain health. So everything you're doing to make your heart work better is going to make your brain work better as well. The bad news is the baby boomers are coming. So the number of people who are in that 28% will go up because there will be more older people. The significant limitations, 46%. You guys were right on the mark here. And frailty, 25%. Only 1 in 4, which is smaller than most people think. Okay? I'm going to show you a few other things that I didn't ask you because I think they're interesting. The percent of people who live alone is 27%. The percent who live in nursing homes is somewhere between 13 and 15%. And the percent that feel they are a burden, this only came from one study, okay? It was 10%. So to sum it up, most of us are going to live into old age, and you know we're going to be in pretty good shape. All right? So who are you going to be in old age? I'm going to talk to you about 3 of my patients. They are all 85 years old, okay? There's Rose, there's Isaiah, and there's Nancy, okay? Now, this isn't really a picture of Rose. I got it off the internet, but it looks like Rose, okay? All right. So Rose considers her health excellent. She developed high blood pressure, and she was really upset. And I said to her, you know, 90% of people who are 90 or older have high blood pressure. She said, oh, it's normal. I don't have to do anything about it. I said, no, it's normal, but you do have to do something about it. Because when I was in training, we didn't do anything about it. We were taught not to treat high blood pressure in older people because the thought was we would cause strokes by lowering their blood pressure too much. And then the studies were done. And treating high blood pressure in older people decreases stroke, decreases heart failure, and increases survival. Okay? So she's very concerned about her blood pressure. It's great right now. And she has a good chance of making it to 100. She had 2 new great-grandchildren born last week. Okay? She's got every reason in the world to want to stay alive, at least until their bar and bat mitzvahs. Okay? This is Isaiah. Isaiah was not as lucky as Rose. He developed diabetes, and he's had it for about 40 years, and his vision is really poor. He also has COPD, lung problems. He was a smoker, as many of us were. And then this year, to add insult to injury, he developed rheumatoid arthritis. And he's concerned. He's in pain. He's having difficulty using his hands. He's depressed, and he's scared about what the future is going to bring. He's had a big change in his life. And this is Nancy. Nancy has mild Alzheimer's disease. She also has COPD. She lives alone. And her biggest concern, she's been losing weight, and she doesn't know why. But she used to walk up to her synagogue every day. And that was her socialization. She went to morning minyan. She had a meal, you know, all of that. Now she's having more difficulty walking. She's short of breath when she's walking, and she's really afraid she's going to fall. I'm really concerned, in addition to all that she's unsure what medication she's taking. Okay? So here they are. They're all 85, but they're very different. And this is something we in geriatrics call the heterogeneity of aging. Or if you've seen one 80-year-old, you've seen one 80-year-old, okay? And what is important about this is that they're the same age, but their vulnerability to adverse health outcomes is different, okay? And that's what we refer to as their biologic age. And people are working to get algorithms and things to, you know, put you through the grinder, say this is your biologic age. We're not there yet, but we do have a way to kind of use 3 buckets. And the first bucket says you're fit, okay, like Rose. The second bucket says you're frail, like Nancy. And the third is that you're vulnerable. You're in between. You could go back toward fit, or you may go toward frail, okay? So there is a term that's being used now called weathering. Have any of you heard about this? Okay. The book that came out about it was from a woman, her parents were Holocaust survivors, and she's talking about this as accelerated biologic aging because of all of the adverse conditions and trauma that you've gone through during your life and the stress that you've gone through during your life and how this affects your health and causes it to deteriorate early. So this is a slide that shows you that median life expectancy that we were just talking about from the year 2000 on the left to the year 2019 on the right, so right before the pandemic, okay? And if you look in the middle, you see green and black lines. And that's the increase in life expectancy in all people in the United States and white people in the United States during that 19-year period. And what may be surprising to you is that the Latinos and Asian and Pacific Islanders started with a higher life expectancy and it increased during those 20 years, okay? Not totally sure why. Part of it probably has to do with family structures, okay? If you look at the bottom, the American Indians and the Alaskan Natives were low and stayed low. And Black Americans were low, went up, but 20 years later still were not where white Americans were, okay? We have a lot of work to do to try and get some equality here. Going back to biologic age and chronologic age, I want to spend a few minutes talking about what does fit mean. Now, have any of you read any of Roz Chast's work? She's a cartoonist for The New Yorker. She wrote a book a couple of years ago that was called Can We Talk About Something Else Right Now? Which was about her parents getting older. And she said, you know, this is what she always thought old age was going to be like. This is TV commercial old age. Spry, totally independent, just like a normal adult, but with silver hair, okay? Well, that makes you think that all this stuff we hear about 80 being the new 60 is true. Not so much, all right? I think all of us look at ourselves and say we look better than the generation before us if they got to this age, okay? And I think that's true. But there's still a lot of things that happen with normal aging that you need to know about. So I'm just going to mention a few of them. You're going to walk more slowly. You're going to spend more of your energy on walking. You're going to, and there are a lot of reasons for that. I'm not going to get into them right now. You're going to have flabbier arms and a pot belly. I have patients who come to see me just, how do I get rid of the pot belly? You can't get rid of the pot belly, all right? You have a change in the fat distribution in your body as you get older. It likes the belly. It doesn't like here, okay? You have senior moments. We all have senior moments. The medical term for senior moments is tip of the tongue phenomenon, okay? You know what you want to say, you just can't get it out. You know who that actor is, you can't get it out. The thing about senior moments is once you get it, that information is yours. You have it stored, you just couldn't get it out. Whereas people who are actually starting to have memory problems can't remember it afterwards either. They do not store as well. You're more sensitive to medications. You can be taking the same medication for the same amount of time, for a long time, and you'll need a lower dose. Thyroid medication, insulin medication, you're going to need a lower dose. You're going to be more sensitive to any medication that touches your brain, okay? And you're going to have side effects that aren't what's on the list that they give you. Although sometimes it's hard to believe there's anything that's not on the list that they give you, right? It's like side effect after side effect after side effect. You're going to urinate more at night, whether you have a prostate or not. One of those nasty tricks. There is a hormone that keeps you from urinating at night when you're younger that doesn't come out as much at night when you're older, okay? You're going to get dehydrated and not feel thirsty. This is really important to understand because when you get dehydrated, you can fall, you can get confused, you can have heart problems. There's lots of things that can happen, all right? And with the weather that we've been having these summers, it's very easy to get dehydrated. Studies show that when they take young people and old people, deprive them of water, get them dehydrated, and look to see if they ask for fluids. The young people do, the old people don't. They have to be much more dehydrated. So it's really important that you keep track of how much fluid you're drinking, whether or not you think that you're thirsty or dehydrated. Now, I know that's tough when we go back to the one before this, the problems with urination as you get older, but you need to figure out a balance, okay? The way that medical diseases present can be different as you get older. 80% of people who have a heart attack and are over 80 years old don't complain of chest pain or pressure. They have shortness of breath, they lose consciousness, they get confused, but it's not the usual thing that we think of. So it's really important that you get checked out and that your doctors know that. And for those of you who are still having sex, sex is less spontaneous. You got to prepare a bit more, okay? You got to use more pressure, you got to have pillows, whatever it is you need, okay, to make it comfortable. So that's all part of normal aging. There's another group of things that aren't normal, but they're really common. And so this is where Roz says about her parents, I could see that they were slowly leaving the place of TV commercial old age. And this is meant to be blurry because you move into this blurry part of old age that was scarier, harder to think about, and not a part of this culture. For those of us who are geriatricians, we tend to call these geriatric syndromes. So let me tell you what they are, and then I'll tell you why we call them geriatric syndromes. They're things like falling, having trouble with your gait and your balance, trouble with your memory, with your cognition, problems with weight loss that you didn't intend to have, or being malnourished. Big problem with older adults not eating enough protein. Vision and hearing impairment, incontinence, mood disorders, feeling like you don't have the energy you used to have and wondering if this is something normal or not. Arthritis and pain, which many of us have. I'm a Tylenol addict, okay? Your sleep changes. You become a much lighter sleeper. So things that didn't wake you up when you were younger will wake you up now. And frailty, which we'll talk about more in a moment. So there are a couple of things about these geriatric syndromes. They aren't caused by just one thing. It's not like you got the flu bug and you get a cold and a cough and all of that. They're caused by several different things that together increase your risk of falling or having a memory problem or not eating well, okay? And the good news about that is that these things like not drinking enough, not getting enough exercise, if you start to do them, they can make many of these much better, not just one. So as an example, if I tell this guy to start exercising, his walking, his balance will get better. He will fall less. His thinking will be a bit clearer. His mood will be better. His energy will be better. He will sleep better. And he will be less frail. And I'll show you about that in a minute, okay? And if I teach him the right exercises, his incontinence may get better, and his arthritis and pain could get better, all from changing one habit, okay? This is something you can't see, and I know you can't see, okay? I just wanted to mention that in the back of the book, I have something like this for all of these geriatric syndromes that talk about all of the various things that could be causing it, that you can fill out and take to your doctor and say, this is what I've got going on. Can you tweak any of these so things will be better? Okay, I'm going to move into some information about frailty. And I'm going to ask you first, how many of you remember Supreme Court Justice Potter Stewart? That's why I like this audience, okay. It's a while ago, but what you probably remember about Potter Stewart was that he was the justice who was asked to define obscenity. And he said he couldn't define it, but he knew it when he saw it, okay? And that's how a lot of people feel about frailty. They're not sure exactly what it is, but they know it when they see it. And that's true to a point, because we think about somebody who's thin and walking slowly and curled over and all of that. But you know, we are having an epidemic of obesity in our country. And you can be obese and frail because that fat gets into your muscles and makes your muscles weaker. And I'll talk to you about that in a minute. So what is frailty? The definition is a loss of physiologic reserve needed for dealing with stresses like illness and trauma. It's the resiliency. It's the ability to get back to where you were before. And for those of you who are more visual learners, what you see here is a little boy on the right and an old man on the left. And you see two brown areas. And together, that's all of your physiologic reserves. And what you see in the dark brown, is the physiologic reserves that you have available should you get in a car accident or have a terrible pneumonia. And what you see in the bottom are the physiologic reserves you're already using to do your everyday activities. And as you get older, you're using more of these reserves to do your everyday activities. And so it takes, you know, when trauma happens to the little guy, he's got a lot of reserve. But when it happens to the older person, not so much. And it's much easier for them to have those bad outcomes that we were talking about before. This looks like a complicated slide. I'm going to walk you through it because I think it's the most important take-home for you. We're talking about frailty, and we're talking about something called the cycle of frailty. And the word we're going to start with is a Latin word, I think it's Latin, sarcopenia. Sarco meaning muscle, penia, not enough, too little. And so the thing that starts frailty is having too little muscle. As you can see at the top of this slide, with age, your muscle mass and strength decreases. That doesn't start at 65. That starts at 30, okay? Yeah, and your whole life you've been kind of making up for that up until this point. So there's a normal age-related, but then there are a lot of things that can make you lose even more muscle. And these are them. And the first is inactivity. And the pandemic taught us this. As we turned into couch potatoes, we got a lot weaker, a lot more frail. Acute illnesses, undernutrition, obesity, chronic diseases, some medications, all of those can cause sarcopenia. So what's the problem with sarcopenia? If you go around the circle, your strength decreases, your exercise tolerance decreases, you can't do as much as you did before, and you're more and more exhausted. Then you walk even slower, you're unable to do as much as you were before, and so you do even less. And you go around and around and around this circle. And that's what you don't want to do, okay? So how do you avoid it? You try to avoid all of these things, okay? It's not easy, but it's really important. So, all of these are things that can happen as you age, but what really matters to most of us, regardless of our age, and I would argue that we want lives that are enjoyable, engaged, and meaningful, okay? It's part of the reason you're here, right? You come to the senior center to have all of that. And I think the first thing we all need to do is make peace with aging. And you've seen this before. in all of the Anon programs, okay? You need the serenity to accept the things you can't change, because as you get older, things are going to happen you can't change. But the courage to change the things you can, to adapt to your new normal, and the wisdom to know the difference, to not drive yourself crazy if it's something you can't change. So I love to remember there are real upsides to aging. The first is you're less insecure, and I really feel that. You're able to say and do what you want. Now, if you asked people who've known me throughout my life, they'll say I always did that, but not like I'm doing it now, okay? You're more likely to see the big picture and less likely to get lost in the weeds. You recognize that time is limited, so you have a greater focus on the present and what's really important to you. We actually have more emotional control as we get older, or as I say, less road rage, okay? That doesn't mean you're not going to lose it, but it means you're going to lose it less often, and it's going to last a shorter period of time. And why is that? Because you've lived as long as you have, all right? You've learned ways to deal with all of these things. What really matters and what doesn't. Is it worth getting this upset over that? Okay? I want you to spend some time thinking about what's next in your life, because wherever you are in your life, there is time left. You could have another 20 to 40 years. What are you going to do for the rest of your life? Who are you going to be? Where will you live? How do you want to spend your time and energy? Are there any roads not taken that you'd like to explore? So I'm 72, and I'm actually, I was just telling some folks, having the 60th anniversary of my bat mitzvah in December, okay? And I'm doing this because when I was 13, they didn't let girls do much. Yeah. I mean, you really didn't do much. And I thought, I'd like to do it right. So I'm doing it again. It's a road not taken. You don't need to be an overachiever. You just need to do something that you really want to do. So you guys know who this fellow is, right? Yeah, that's Jackie Gleason, okay, or Ralph Crandon. We used to think he was obese. He actually looks kind of normal now. I used him to represent a patient of mine named Mike. Mike was a bus driver. He was a milkman. I met him when he was 85. He was married forever, had 2 children. His wife got really ill, and he nursed her through the end of her life. When he was about 80, he got on Match.com. He met Annie. Annie was a children's book writer, very prolific, lovely, and they traveled all over the world together. Okay, they had a map in their apartment with pins every place they'd been. He started writing poetry and plays. He's never done anything like that before. And they had a great 7 years until Annie died. A couple years later, there was Madge from Match.com, okay? And he was doing great with her. He lived half time with her and half time with his daughter, okay? That kind of made it a little easier for everybody. He turned 95, and he said, I haven't been with my son enough. So he went out to California, which is where he is now. And how does he spend his time? He's trading stocks on the internet, all right? So what did I learn from Mike? How you react to aging can have a major influence on what your old age is going to be like, okay? He just embraced it. Who's this woman? Grandma Moses. So what you might not know about Grandma Moses is she didn't start painting until she was 76. And the reason she started painting was she could not use her embroidery needles anymore because her arthritis had gotten so bad. And she painted every day for 25 years, okay? So I'd like to end with just a couple of thoughts for you. We are a country that is very involved in being independent. We all want to be independent. We want to be autonomous, okay, self-reliant. But you know, if you're not independent, then you're dependent. And nobody wants to be dependent, right? I think we need to start thinking of something called interdependence. And what does that mean? It means you don't need to do everything by yourself, but you need to do what you need to do to be able to do the things you want to do, okay? So if that means that you have to have an aide go with you to something so you get to go and see what you want, great. If it means you need to use a wheelchair to get around the museum or in the airport, fine. Whatever it is to allow you to do what you want to do. Don't forget that. It's not all, I've been talking as if all of this is up to each of us individually. In this country, unfortunately, it can be, all right? But there are other things that can be done from a societal point of view that make a difference. I'm just going to give you one example from New York. We have an age-friendly New York commission. And they went around to all the boroughs, and they wanted to get people, figure out why people were not using public transportation. So they asked about the buses. And folks said to them, I don't use the buses because of the bus shelters. They're opaque. Anything can be going on in there. And they have a bench where people are sleeping all the time. So this is what they did. They created transparent bus shelters, and they have a bench, but the bench has dividers, so you can't sleep. And for those of us that need a little bit of help getting up, it's very helpful, okay? There are things that we can do. We can make cabs, say you can't have cabs where you have to jump up to get into these cabs. I don't know if you have them here. We have them in New York. I had a patient who fell from the cab, and that was kind of the end of his life, okay? Shouldn't be. So I'm going to end with my tips for an enjoyable, engaged, and meaningful old age. And the first is resist ageism wherever you see it. Don't let people get away with it, all right? If the nurse in the doctor's office calls you cutie, yeah, my name is, if you don't like it, all right? I mean, most of us get to the doctor's office and we're a little nervous. And being called cutie, or somebody said to one of my patients, I want to take you home with me. That didn't make her feel good, okay? Make friends with people of all ages. Talk to everyone. I have a friend who calls this social insurance, okay? You can help them, they can help you. Right-size your expectations. You will not be able to do everything you could do when you were 30 or 40, but you probably can do a lot more than you can do right now. I had a friend whose father was a Marine, and he, at age 80, went back to the gym. And after 2 days, he was calling it quits because he couldn't get anything done compared to what he, in his head, thought he could do. And I looked at him and I said, you know, there are people who win the Boston Marathon who are in their 20s, and there are people who win the Boston Marathon who are in their 80s. And they're each as in the best shape you can be for that age. But there's a couple-hour difference between how long it takes to do the course, all right? So accept what you've got, but make it better. Be resilient, adaptable, and flexible. This is like the hardest thing in the world, okay? And I tell my medical students that's the time that they should be learning this. But it's so easy to get rigid. Can't do that, you know? And that goes along with my never say never. You know, I make recommendations to my patients and families. I'm never having an aid, I'm never using hearing aids, I'm never whatever, okay? And I have a 6-month rule. I give them about 6 months of discussion. Usually by 6 months, they're willing to try it, okay? Advocate for yourself, but let others advocate for you as well. And this is particularly in healthcare. We have a very broken healthcare system. Yeah, anybody who's going to help you, take advantage, okay? If you can't do everything you want to do, select what it is you really want to do. Optimize yourself, get a nap during the day if you want to go to a concert at night, and compensate. Use whatever you need to be able to get to that concert. Laugh more, okay? We are very serious these days, and there's a lot of reasons. But it really helps to laugh a bit more. And get a doctor who knows the difference between caring for 80-year-olds and for 60-year-olds. So who are you going to be in old age? This is my favorite picture, again, off the internet. Same guy, 4 different times of his life. And I think most of us know what it feels like to look in the mirror and see that top picture and be a little surprised at times, okay? And remember all these other parts. And what I teach my students is, you're only seeing this. All of that is there too. You know, get to know who this person is. As Gertrude Stein said, we're always the same on the inside, okay? So that's the book, Honest Aging. Some people are calling it the Dr. Spock for older adults. That's not to infantilize us, but that was a pretty smart book in terms of giving some ideas for ways that you can adapt to things, okay? Thank you very much, and I'm open for questions. In the back, we have a microphone coming to you.
Why is it that there are so few geriatric doctors? Everybody tells you, go get a geriatric doctor. I've been to a seminar where the day after I went to the seminar, I was told that so-and-so was taking patients. Call the next day, they're not around.
It is a huge problem, okay? So I'll answer it in 2 ways. There is a problem in this country with having enough doctors in any field where they're not doing a procedure. So endocrinologists, rheumatologists, infectious disease, and geriatrics and primary care all are having trouble getting doctors to go into those fields, okay? There used to be a concern financially. That's not as much as it was. And as I keep saying, I don't know anybody who's not in the 5% who practices geriatrics, okay? The second is that people don't see it as sexy or interesting. And so one of the things that we're doing to really try and change that, 2 things. 1, make sure that every doctor gets the basics, okay, whatever they go into. Because if they're a cardiologist or an orthopedic surgeon, they're going to take care of older people. So we're working on that very hard. And the other thing is to have mid-career pathways into becoming a geriatrician. Because oftentimes people go out and practice for 10 years and suddenly they get it. They didn't get it when they were in their 30s, but they've got it in their 40s and their 50s. So we're trying to increase in that way. Any other questions? Yes?
When should you see a geriatrician? At what age should you consider that?
At what age should you consider seeing a geriatrician? There's not an age, okay? It's really how you're doing. So in our practice, we take 75 and older. We may even move it to 80. Yeah, because if you're doing well, you really don't need us, okay? We're best for geriatric syndromes and multi-complexity when there are a lot of things going on at once, okay? So as geriatricians, we spend a lot of time looking at medications, at mobility, at your mind, at how these diseases work together. And the most important thing, which is what you have to do, what really matters to you? You know, we as doctors get all these guidelines. We're supposed to have you do 25,000 things. And then each time you do one of them, oh, well, there's something a little abnormal here. You got to do this, okay? We're not sure about that. You need to do this. And you can feel like you're spending your entire life doing medical things. And that's not what the purpose of your life is right now. And so what I find with my patients is it's very helpful, and there's actually a website about this. If they say to me, I want my health care to make sure that I can get to my daughter's wedding in June. What's keeping me from that? My incontinence and my walking. And then we can work on those things, okay? But as you get older, the evidence that exists is not as good for older people because older people are not in trials, and older people with several diseases certainly aren't in trials. So we don't know if the recommendation works, And we don't know what the harms are in older people until whatever it is has been done for a while. So you really need to say, my health care is in service to me. What is it that I want? And talk to your doctor about that. Okay? Sure. Yes?
It may be embarrassing, so somebody might not ask, how do you start evaluating incontinence?
How do you start evaluating incontinence? I could say buy the book, but I won't say that. The thing that you need to do is figure out if the problem really resides in your bladder and kidneys, or if it's something else that's causing the incontinence. And that can be muscle weakness, that can be diuretics, there are all sorts of medications, it can be that you have a cough, okay? So that's the first thing. The second thing, if it really is incontinence, is to figure out which kind. So there's stress incontinence where you cough and it comes out, okay? There's urge incontinence where gotta go. You see those ads all the time, right? And depending on what kind you have, the treatments differ, okay? Sure. It's an important question that a lot of people don't talk to their doctors about. Yeah, they wear a diaper, and that's like, don't do that to yourself. At least see what you can do to make it better. Yes, sir?
Is your book in Braille?
My book is not in Braille. There's an audio book. I've been told that the person who read it isn't so great. I haven't listened to it myself. Okay?
So you have an audio book?
Yeah, there is an audio book. Yeah. Yes?
It seems like today, whatever is wrong with you, they tell you to go.
I'll repeat it. Whatever.
Whatever's wrong with you, they say to you, go for PT.
Yes. So.
Where did this all come from? Everything seems to be resolved if you go for PT.
So the question is, it seems like today, whenever you go with a concern to a doctor, you're referred to PT. What is it about PT? Okay. Hopefully they will do the underlying things to make sure that the problem is a musculoskeletal problem and not something else. If it is a musculoskeletal problem, physical therapists can be amazing, and they can get you an exercise regimen that really works for you. They can help you learn how to get up and down from chairs if you're having trouble, or stairs. So there's a lot they have to offer, but you need to find out what's underlying the problem. Okay? Yes?
It's not a question, but somebody once told me it's a privilege if you live to be older. And I like to think about that because we've all had friends or siblings who have passed on. So
Yes.
I like to keep that in mind.
That's a really good point, that it is a privilege that we live to be older. Do you know that in 1900, average life expectancy was 47? And now it's 78? I mean, part of the problem we're having as a country is we never had this before. You know, individuals would live to be 80. That the vast majority of people died before that. So, yeah, you're right. It is a privilege. It's a gift, if we look at it right. Yeah. Okay, thank you very much. Oops, one more.
Do you know how old Moses was when he died?
How old was Moses when he died? I do not remember. 800? I don't know. No, I didn't go to school with him. Sorry.
You have a Jewish background.
I certainly do. I can tell you David was 70. But Moses, I don't know. I'll have to look it up.
Thank you so much again, Dr. Rosanne. Thank you, thank you, thank you. Her book, she'll be signing books in the rear where Nancy is standing. They're $20 each. We are going to be serving lunch soon, but I just want to mention one of Roseanne's top points was to be part of a fitness center, and if you are not part of the Worcester Senior Center Fitness Center, please check that out because it is free for everyone, and I think that's going to help a lot of our issues that we're having.
Yes, yes.
So sign up for the Worcester Senior Center Fitness Center if you have not.
Sign
Thank
up
you
and
again.
go. Don't just
Sign
sign
up and go. Sign up and go.